Welcome back to the channel. I wanted to just touch on 3 common misconceptions that we hear quite frequently in medical practice. I've been practicing medicine now on my own for nearly 30 years, and I've heard quite a lot. We call them wives' tales. At the same time that we don't ever want to dispel the wisdom of Dr. Mom, I think there's some things that we need to set straight. The first one, and one of the most common ones, is that if you go outside with your hair wet, you're going to catch a cold. Well, there's absolutely no biological fact or basis for that to be true. You can walk outside as often as you want in hot weather, cold weather, when it's freezing cold or when it's raining outside, and it's not going to increase your risk of catching the cold. Catching a cold is a matter of coming in contact with the upper respiratory virus called adenovirus that actually causes the common cold. If you have wet hair and you don't come in contact with the virus, you're not going to get sick no matter what. If you have dry hair and you do come in contact with the virus, then you're going to catch a cold. Another misconception that I hear about often in the office is that if I take that flu shot, I'm going to catch the flu. Well, in the past, there actually was some truth to that. About 10 to 15 years ago, we used to use what we called a live viral vaccine for influenza. Meaning it actually did have live influenza virus in the vaccine. Now we only use attenuated virus, meaning a piece of a viral coat that will stimulate a good antibody response against influenza infection. There's no live virus in there. Therefore, it's absolutely impossible for you to catch the flu from a flu vaccine. You may get some side effects. You may get a little low-grade fever. You may get some body aches. You may get a runny nose and even a little bit of a cough. That's just your body's immune system revving up against a viral attack should you actually come in contact with the true virus. Another myth that I used to hear more frequently in the past, less so now, but it still comes across my desk from time to time, is patients who are diagnosed with cancer who will refuse to have surgery to remove the cancer because they've been told that once that cancer touches the air, it's going to spread. They go back and they have anecdotal stories about how an uncle or an aunt or a parent who had cancer had surgery, and then once they poked the patient up, they found that the cancer was all over their body. And it didn't seem to be that way before the surgery. Well, the truth of the matter is that having air touch cancer does not make it spread any faster. Generally, in those cases that are referred to, this is a patient who already had metastatic disease, but it wasn't discovered until the time of surgery. Indeed, in many cases, surgery is the only way to really get cancer diagnosis under control. You have to debulk or get rid of the largest portion of the cancer. Then any remaining cancer can be more susceptible to the other treatment modalities of chemotherapy and radiation therapy. So having the surgery does not make it worse. In fact, it may be the only thing that can spare your life. Thanks for tuning in on the channel. We want to just ask you again, please hit that subscribe button if you've not already subscribed to the channel. Press the like button so that we can keep track of whether or not people are really appreciating the content that we're posting. And then hit that bell notification. So as we roll out new content, you'll be the first to hear about it. Don't forget, we've been doing this for a minute now. We've got quite a little library of videos that are stacked up. Go on in the channel. Take a look around. See if there's a topic that you've been wondering about that we may have already touched on in the past, and you can get some information. If you see something or you have an idea about something that you don't see in the library, let us know. We're looking forward to hearing from you.